Good evening. We want to thank you for joining us for our COVID-19 Community Town Hall, Vaccination One-on-One, Expanding Access to a Community in Need. My name is Genesis Robinson. I am the Volusia County Regional Coordinator for Equal Ground Education, a statewide civic engagement and community-based nonprofit in Central Florida, with the mission of expanding political power to marginalized communities and empowering the next generation of Black leaders. Today, we have joined with our partner organizations to present this forum as a public service in an effort to educate viewers about the impact of COVID-19 has had on our community and share relevant information that could help those who are still undecided about being vaccinated. Since the pandemic has started, Equal Ground and its partners have been on the front lines working to do our part to not only keep our community safe, but to also keep our community informed. Once the COVID-19 vaccine became available, we partnered with key stakeholders to expand access to traditionally marginalized communities throughout the state, including here in Volusia County. Since the start of 2021, Equal Ground has made over 18,000 phone calls, and we've sent over 68,000 text messages, connecting Floridians to vaccine opportunities throughout the state, also here in Volusia County. While we are proud of the work that we have done, we recognize that there is so much more to do. At this time, I'd like to take a moment to acknowledge our partners and our panelists for this evening. Not only is Equal Ground, planning and hosting this event, but we're joined by our great partners, the Volusia County African American Leadership Council, and their co-chairs, Mr. Rufus Johnson and Mr. Kelvin Maynor, as well as our administrative support person, Ms. Daisy Grimes. We also like to acknowledge the Daytona Beach, Volusia County NAACP, under the leadership of Ms. Cynthia Slater and First Vice President, Pastor Evan Smith. We'd also like to acknowledge the minority elected officials under the leadership of retired Judge Hubert Grimes and Executive Director, Mr. Mario Davis. We'd also like to give a special acknowledgement to the Volusia County Links for their collaborative partnership in helping to make this event a success. And also our moderator for this evening is also a member of that organization. Now, tonight we have a stellar lineup of panelists. We have our moderator will be Ms. Maxine Mann. She will be joined by Councilwoman Barb Gertman, Dr. Carol St. James, Dr. Courtney St. James, and Dr. Tanya Williams. So at this moment, I would like to turn it over to the Volusia County African American Leadership Council co-chair, Mr. Kelvin Maynor, to bring us greetings.
Good evening, all. Welcome and greetings on behalf of all the members and my co-chair, Mr. Rufus Johnson. I would like to extend a warm welcome and greetings on behalf of the Volusia County African American Leadership Council and all of its member organizations. We look forward to a very informative session this evening. We'd like to thank Mr. Genesis Robinson, Equal Grounds, and all of the panelists who will be imparting knowledge on us. Again, greetings and welcome.
Thank you, sir, and thank you for your leadership. At this moment, we will now be hearing greetings from Pastor Evan Smith, as the first Vice President of the Daytona Beach NAACP.
Thank you, Genesis. Good evening. My name is Evan Smith, and on behalf of our president, Madam Cynthia Slater, and the NAACP East Volusia branch, we bring you greetings. It goes without saying that these are some tough times, and we still have a lot of difficult days ahead. and we are in desperate need of town hall meetings such as the one we're about to experience tonight. And we just want to thank everyone who has made this event possible, because this pandemic has affected us negatively in every way imaginable. And so we thank not only those who have organized this event, but we also want to thank our panelists for sharing their wealth of experience and knowledge. We know that the Word of God teaches us that my people are destroyed for the lack of knowledge. And so we are grateful for the knowledge that we're going to receive as we look forward to move forward with the vaccination and get back to some sense of normalcy. So thank you on behalf of our president, Madam Cynthia Slater, and the NAACP East Volusia branch. Once again, we bring you greetings. Thank you, Minister Genesis Robbins.
Thank you, sir. We certainly appreciate your leadership in our community, and thank you for your greeting this afternoon or this evening. So now at this point, I would like to introduce our panelists. We have a stellar lineup of healthcare professionals and elected officials who will provide some insight as to how COVID-19 has not only had an impact on our community, but what we can do to do our part to to be vaccinated and come out on the other side of this healthier and stronger. So tonight, our moderator will be Ms. Maxine Mann. Ms. Mann is a dual mastered prepared registered nurse for over 45 years. She also serves as the owner-operator of an outpatient office space surgery center here in Volusia County. We also have Councilwoman Barb Gertman. She was elected to the County Council in 2018. Prior to being elected to the County Council, she served on the West Volusia Hospital Authority, where she also had the honor of serving as the chair for this powerful committee in our community. She is a realtor by profession and has helped hundreds of Volusia County residents fulfill their lifelong dream of home ownership. We're also joined by a name that many of you may know, Dr. Carol St. James. Dr. St. James has been a family primary care physician in our community for a very long time. She has a family of doctors. It seems like the entire family is in the healthcare space, and she's a very trusted voice in our community, and we're happy to have her joining us. She is a graduate of the University of Florida College of Medicine. So we thank you, Dr. Carol St. James. We also have another St. James. As I said, the entire St. James family is, we have Dr. Courtney St. James. Dr. Courtney St. James completed her medical degree at American University, College of Medicine in Antigua. She continued her training in Georgia, completing a residency at Mercer University, where she went on to become a certified doctor under the American Board of Family Medicine. And she also is a primary care physician practicing in Deltona. And then last but certainly not least, we have Dr. Tanya Williams. Dr. Williams graduated from FAMU College of Law with a doctorate degree in pharmacy and pharmaceutical science. And she currently is a consultant pharmacist and staff pharmacist at Florida Healthcare Plans. So at this point, I will turn it over to our moderator, Ms. Maxine Mann, and she will begin the program. Thank you.
Mr. Robinson, thank you so much, and I'm so delighted to be here. And hello to all of you out there. Thank you for joining us for this discussion that I feel is so very important to capture the conversations that so many of us are having these days, coronavirus and the vaccine. We're here this evening because we care about the citizens in this community, and we feel that it is important to address some of their many concerns as specifically related to the COVID-19 vaccine. This is a time when we're looking for information as these vaccines are being dispersed throughout the nation. Millions, tens of millions are infected with this vaccine, and hundreds of thousands have died. As April is National Minority Health Month, this is the perfect time to discuss our topic, COVID-19 Vaccination 101. We plan to explore updates on the spread of the virus, vaccine options, including the latest update on the Johnson & Johnson vaccine, and bring you some general information on the benefits of receiving the vaccine. We're also planning a question and answer session, so I'm encouraging you to place your questions in the chat box so that you will have an opportunity to get them answered from the expert panelists in the field. As you have already heard, the many accolades of our esteemed panelists, you are truly in for a treat from this group of female panelists, no less. And they're here to bring us the latest and greatest COVID-19 vaccine information and to answer all of those burning questions that we have. Without further ado, my first speaker of the evening is Councilwoman Barbara Gertman. As a community, it goes without saying that our communities have been hit very hard, both personally and fiscally. Besides the effects COVID has had on each of us, from possibly having personally having to battle COVID yourself or your family members fighting the COVID infection, to the loss of family, relative, close friends and neighbors, to being shuttered in and not being able to go to work, your children to go to school, you able to go out or to the community parks and recreational centers, not to mention not being able to attend church, and the list goes on and on. What about the fiscal aspect? Loss of jobs, not having enough money to pay for food, pay for your housing. And again, this list is exhaustive, and the impact on our community has been astronomical. Councilwoman Gertman will shed some light on how COVID-19 has impacted our community from both the human and fiscal impact, as well as the impact on government services. Councilwoman Gertman.
Thank you so much. Thank you for having me. This is such a critical issue, and I will say I've understood the urgency of this situation from the very beginning. Unfortunately, I had a cousin in New York who within the first 90 days of this crisis passed. She was a singer in the church, and a number of her choir members, church members, and even her pastor passed from COVID-19. So from the very beginning, the urgency and the critical understanding that we needed to do everything to take precaution. And I was one of the main one on our council to make it clear that the Black community, the Black and Brown community, were really being impacted by this virus, especially with us being on the front line on jobs and not having a lot of the resources or the options not to go to work or to work with having your children at home and just everything that this virus brought in the early stages. So locally, we saw very much the same thing. We've lost a lot of our local leaders. We've seen a number of our people in the hospital for weeks. And you have to wonder, what's the impact on the family? What's the financial impact? What's the mental health impact? Also, we look at our seniors that we weren't able to spend time with during that time. I have an 87-year-old mom who lives 10 minutes away from me. We had to decide, would she suffer more from the isolation or the potential, being affected by the virus. Thankfully, we're all fully vaccinated now, but early on, the question was there. So I will say that the county has, the emergency management team for the county has really stepped up. I asked them early on, I made them fully aware of the concern and the impact, especially in the Black community, where we're told that we're 2 to 3 more times likely to be infected and 2 times more likely to die from it because of our comorbidity, and I think also because of the exposure being on the front line as much as we are. So early on, because of my concerns, the county acquired a number of PPE. So we were responsible for distributing more than 50,000 packets of PPE in the community, in the Black and brown and underserved community, to try to get the resources in their hand to try to keep and hold down the virus, but also help explain to the community that this is serious and it should be taken seriously. We also, during the time when we didn't have testing in our community, worked with the city of Daytona, worked with emergency management and NAACP, as well as the former representative for the state, Santiago, to bring testing to Daytona to ensure that the Black community had access. And we typically bring things to Daytona because we know there's a greater population on the east side of Volusia County, but really it's for all of Volusia. It's just we have to put resources where you can get the most, have the greatest impact. And we find many times that is in Daytona, and especially we've been able to utilize the Midtown Cultural Center often. So lastly, we're here to talk about vaccine, and the same thing happened with the vaccine. So we were able to, prior to the state, prior to Governor DeSantis getting a team to Volusia, when the discussion happened about Black and brown, the impact, and getting the vaccine to us earlier, we were told that Volusia was not a priority, that they were sending early vaccine distribution and opportunity to South Florida. Our team knew I was not satisfied with that, and I was pleased to see how they did a set aside of the vaccine that we received for our general distribution. There was a set aside that we were able to work with the Department of Health and bring the first vaccine event for Black and brown and underserved, again, to the Midtown Cultural Center for the first time. And we've since had 11 such events throughout Volusia County, underserved, whether it was in DeLand's Spring Hill area, whether it was, again, we've had several events at Midtown, New Smyrna Beach, Deltona, Pearson. So we have tried to make it as accessible as possible, while we also sought to educate. And there were so many volunteers that stepped up that I'm just so pleased with how we were able to get this done. We worked with the Black clergy on the east and west side, so I've got to give a shout out to Pastor Gooden and Pastor Rollison on the west side, because they helped make it happen. But there are also volunteers. There was Cynthia Slater, there's Kim Crawford Brown. They all pulled together, and we've been able to register or vaccinate thousands of people from the Black and brown communities. So I think it is critical. I'm really pleased that my team listens. The Volusia County Emergency Management knows where my heart is, knows when I say I have a concern that there's a basis for it. There's science and statistics to support it. And they've been able to step up and support me, because typically on the council, I'm the only one speaking about COVID. I'm the one pressuring to ensure that we're wearing masks in our council, and that the people who are sitting before us are wearing a mask and taking appropriate precautions, because that is not always the mindset of others. So I just want to say that I'm really grateful to be here. This is a great conversation, a great time. Going forward, what I want to see, because we are seeing hesitancy, we're seeing vaccine demand slow down. I've asked our team to decide or define if we can do evening or weekends so we can be more available to a younger population, but also identify ways that we can do pop-ups through various communities where people are and encourage them to get vaccinated, because I am so much more concerned with the impact of the virus than I am the side effect of the vaccine. And that is my ongoing message wherever I am. So again, thanks for having me. Thanks for giving me this opportunity to present to the community and let them know that we've worked hard to put the resources out there, and it is critical that to get this virus behind us, we all have to participate. We all have to do our part. And I also have to say that our county staff, though we received, I think, $96 million to distribute and work on the COVID impact, we were able to help. I think $17 million went toward rent assistance and mortgage assistance, also to support small business. So those dollars that were received did go back out into the community. And there's another portion that's coming now under the new administration that has also has a rental assistance support with it. So if there's any questions, please reach out to me. I'm at bgertman@volusia.org. And I thank you.
Thank you so much, Councilwoman Gertman, for that wealth of information. I applaud you for all of your efforts in the direction of standing in the gap for our community, being able to secure the PPE as necessary, testing, and particularly the vaccination events, reaching out and being able to set up 11 events for the underserved. That is super fantastic. I want to remind our guests, our audience, if you have any questions, to go ahead and place those questions in the chat box so that we will be able to get to them at the end of the session. At this point, I would like to reach out to Dr. Tanya Williams as she brings us a quick Vaccine 101 lesson update. Tanya.
Hello. Thank you. I'd like to say thank you to Genesis and Equal Ground and all of its partners for allowing me this opportunity to be on this platform, because as a pharmacist, I'm in contact with people every day, and especially people that look like me, Black and brown people. I ask them, even in the pharmacy, have you gotten your vaccine yet? Have you gotten your vaccine yet? That's just me. That's my personality, because I know the impact that this virus has had on our community, and it's just devastating. It's devastating. I probably can't count on my 10 fingers how many people that I know have passed away personally. So it's a very devastating disease. So thank you again. And just real quick, what Councilwoman Barbara Gertman said, the benefit far outweigh the risk of these vaccines. Okay, so I'm just going to jump right into it. I'm going to tell you the differences between the 3 vaccines that are currently available in the United States under emergency use by the FDA. You have Pfizer, Moderna and the J&J. As you know, the J&J is on pause right now because there have been some issues. However, those risks have been very few, very, very small. So the Moderna and the Pfizer vaccine are both vaccines that use technology using messenger RNA in its vaccine. What this messenger RNA does, it teaches our cell, kind of like a cookbook or a recipe. It teaches our cells, once it goes into the cells, to replicate the spike protein, which we all know what coronavirus looks like. It's it's a little round thing with the spike sticking up. So once messenger RNA enters our body, it teaches our cells to make a portion of the virus, a portion protein from the virus, and that protein is the spike protein. So once those spike proteins are made, it goes into our bloodstream, and then our immune system revs up and produces what is known as antibodies. Now, antibodies are so if you ever got sick with anything, the flu or hepatitis B, there are all vaccines for those things, your antibody will notice that virus quickly and just attack it and kill it. So this is what this vaccine is doing. So once our body, produces this response, it remembers. So if you ever got sick after getting the COVID vaccine, your body, those antibodies will remember, hey, that's COVID. I remember those spike proteins, so we need to get rid of this. And that's what happens, okay? So they do not use any live viruses. I know that's, people are concerned that if I get this vaccine, will I get COVID? No, you won't get COVID. What happens? Let's think about an egg. Let's take an egg. Okay, so in an egg, you have the yolk, the yellow yolk, right? And then you have the white on the inside, on the outside of the yolk, right? So let's imagine that as our cell, as a cell in your body, the billion cells that you have in your body that make you who you are. So when the messenger RNA enters into the cell, it stays in the egg, in the white, in the egg white. It never goes into the nucleus, which is the yolk. Let's think of the yolk as the nucleus. That's where our DNA, what makes us who we are, is held. So it never enters that. So you hear people say, oh, you're going to grow horns or you're going to grow another leg. No, it's never going to change your DNA because it never enters that. It stays in where the egg white is. So once that recipe has been made, once your body, that cell knows to make those spike proteins to to leave the cell and enter into your bloodstreams, and your antibodies are made, they're destroyed. So that mRNA never enters your DNA. So we can debunk that myth right now. So, okay, calm down. It's okay. I know people are saying, oh my gosh, but they came out with this vaccine so quickly. That's not true. This technology has been around for a very long time. They've tried it with Zika, and Zika was what, in 2011? So it's not a new technique. They're trying it with the flu vaccine, and they're also trying it with HIV. And HIV has been with us for forever, for as long as I could remember being a little girl. So it's nothing new. So when COVID came around, all they needed was the genetic makeup of the coronavirus, which was that spike protein, to use this messenger, this new not new technology, but to use this technology in a vaccine. What is new is being in the human. That part is new. This technology has not been used in human, although the technology is not new. Let's make that disclaimer right there. So once your body gets that messenger RNA, you're going to be protected. Pfizer and Moderna both have the same profile, so they're 95% effective. So that 95% means that you are not going to end up in you have a 95% chance of not ending up in the hospital and a 95% chance of not dying from the virus. This is how great these vaccines are. And it's not new. We can't be afraid that because something is new that, it's going to harm us. We have scientists and doctors who have taken an oath to do no harm. And I trust the science. I have a 15-year-old daughter. She trusts the science. She wants her vaccine right now, and she wishes she could get it because she's not 16 yet. So we just have to follow the science, okay? It's going to be okay. So common side effects or symptoms would be, headache, chills, mild fever. And those are normal. That's telling you that the vaccine is working. Okay. So people are like, oh, it made me sick. Well, no, it didn't make you sick. Your body responded to those spike proteins and your immune system did what it was supposed to do for you to fight this virus. Okay. So we're this is great stuff. Actually it's groundbreaking for them to have for this virus to have, first case known in March of last year, and for it to be here it is a year later, and so many people have gotten the vaccine already. So don't let the term warp speed fool you. This technology there's nothing warp speed about it. It's been around for a long time. It's just that this is the first time it's being used in a vaccine. In human trials. So that's the Moderna and the Pfizer. So far Pfizer is claiming that you will have at least 6 months of antibodies or protection. And that's only because there's, based on people they've been tracking, 6 months ago last year, the titers of antibodies are still in their system. So it could be longer, that we just don't know. But the fact that as soon as you get this vaccine and your second dose, you're fully vaccinated, you have antibodies to this coronavirus. So if you should get coronavirus, your body will immediately destroy it and neutralize it. So that's good news right there. Okay. I never wanted to get coronavirus and come into contact with so many people on a daily basis, coworkers getting sick, people. And what people don't understand, this long hauler situation that this virus can cause, brain fog, people having heart disease after having no issues at all pre-COVID, are now having arrhythmias, kidney failure, things like that. So you really don't want this disease. And I'm gonna go back to what Councilwoman Bertman said, the benefit outweigh the risk of this vaccine. Even the Johnson & Johnson vaccine, okay? So the Pfizer Moderna vaccines have not really shown any issues with it, but even with the J&J, it's still better. The Johnson & Johnson vaccine, it uses a different technology. What they do, they took the spike protein that I talked about earlier, that your body makes the antibodies to neutralize the virus. They take the spike proteins from the coronavirus. So again, you're not getting the coronavirus, you're just getting that spike protein so your body can recognize it and produce antibodies. Well, they take an adenovirus, like the common cold. They take that virus, which it doesn't cause the cold in you as well. They take that virus, stick the spike protein in there, and then inject it into you. And from there, it tells your body to produce the spike proteins, and therefore that's how you get antibodies from the J&J vaccine. Now, the efficacy of the J&J vaccine is about 63%, but before probably before they were paused, they were in clinical trials to see what a booster shot for the J&J as well. So I think the J&J will eventually, once it given the approval to go back on the market or for use, I think there'll be a second shot with that one too. But what made the J&J vaccine so important, because it was one shot. And for people who were already hesitant about not getting this vaccine, one shot sounds a whole lot better than two. And at this point, if J&J were available, I would recommend it, me personally. Just from looking at the data, and only 7 million people got this potentially fatal blood clot, you know. So, like, again, going back to that benefit, when doctors are treating any patient, they always look at, even if it's your baby, an infant, they always look at the benefit of this medication versus the risk. And the benefit just have to outweigh the risk in order to be safe or be given. And I'm sure Dr. St. James and both of the St. Jameses will talk to you about that. So I just really hope people just get it. We have to get it. Another thing I like to just share real quick. So as I was doing my research on this, my cousin told me that a friend of hers said her mother was not going to get the vaccine because they used fetal blood. They use like baby blood. I don't know if you've heard that, but I'm about to just debunk that myth real quick. So in the 1970s and in the 1980s, in the Netherlands, they used fetal tissue from elective abortions to study. That's what anything. You use human cells to, be it the placenta. People donate their placenta. People save their placenta, to create stem cells. So when I had my son, they asked if I wanted to keep my placenta. And I was like, no, I'm okay. And store it. So like if my son got sick, like say from leukemia as a 5-year-old, they would use my placenta and create stem cells to help my son fight off the leukemia. So basically it's science, guys. We have to get past this notion of they're trying to put stuff in us. They're trying to do this. No, this is real stuff. People's lives are on the line, and it's just too many people to, that's a big conspiracy for it. That's too many people involved in this, in that type of conspiracy. So so think about it. So if they're using which is called fetal cell lines, over 40 years ago, that it's no longer those tissue. They create, these cells multiply. They've multiplied over thousands of times from the 1970s to to right now. They've multiplied. There is no tissue. So nobody had an abortion last year and they're using this in their vaccine. No, that is not what's happening. These are cells that have been in the lab, under a microscope, replicated over 40 years. Okay, so it's so far removed from that original fetus that it's no longer that fetus. Okay, so when people say that, that's not what's going on there. But there are 3 reasons why they use these cells, which are called fetal cell lines. The first one is called development, and it's to identify what works. So just like any science project, you have to figure out what you need to do to make your science project work, correct? It's science. Everything goes back to science. The second step is confirmation, to make sure what you're doing is going to work or is working, okay? And the third step is production, which is the manufacturing of the formulation to see if it works, okay? So I'm probably gonna makes a few people scared who are nervous about even the thought of using cells, whether it's been, removed 40 years. Um, Pfizer and Moderna only use the fetal cell lines to confirm that what they were using, the technique that they were using, was going to work. So the second step. Now, I will say J&J, they did use it in the production of their vaccine. I have no bad feelings. I'm neutral because, like I said, we all need to be vaccinated. So if you have, you have Jehovah's Witnesses who refuse, blood fusion because, they just don't want to deal with that. You have the option of, instead of using the J&J, you have the option of, Moderna or Pfizer. Now, even the Vatican had gotten involved in this, and they basically, they're against abortion. They even The Pope even wrote basically absolving people that is, the Pope is saying it's this important that we can overlook this, or we have to overlook this to get this vaccine. So I thought that was pretty profound that the Pope would even, assert himself into the situation, being that people would I'm sorry, my camera keeps falling. Would insert himself to say that it's very, very, very important to get this vaccine. So I hope that helped dispel this, a few of the myths that people, have had some concerns about. Last thing here. So like I said earlier, 7 million people. So I'm going to talk about the Johnson & Johnson. Like I said, it's 66% effective. Again, I told you that they were in the process of, giving a second shot to see if that would, as a booster, like the Pfizer Moderna shot. 7 million people have been given a dose. 6 women and 1 man have come down with this rare blood disorder. What it was causing rare brain clot, and also it was causing your blood to thin as well. So I think the lady that passed away, I think she was given a blood thinner because, they originally saw a clot, but then again, her blood is already thin. So I think that's what killed her. And so I think they're working on, doctors are pretty smart. So I know they're going to figure this out. And again, the benefit of getting even the Johnson & Johnson, the J&J vaccine, far outweigh the risk. So 1 in a million of you getting this rare disorder is like winning the lottery, not even winning the lottery, but getting struck by lightning. So that's the example that I can best give. So you're more likely to get struck by lightning than you are to get a blood clot. And also, yeah. And they also found that it's women between the people were between the ages of 18 and 50. So when I first heard about it, that it was women, I immediately thought it was hormonal. I was thinking maybe it's birth control. Did these people smoke? And birth control can give you blood clots. So you're more likely to get a blood clot from birth control than you are from the J&J vaccine. So keep that in mind as well. And if you smoke, your chances of getting a blood clot increases that much more. So I believe all 3 vaccines are very safe, very efficacious. They're going to save lives. Like I said, even with the J&J, you're going to have less if you get it. Because if you get vaccinated, you can still get the virus, but your symptoms will be no symptoms or very mild. And the most important thing is you will not be hospitalized, nor will you die. And that's what I think people need to think about. Am I gonna end up in the hospital if I get this vaccine and I'm not gonna die, or am I gonna just take my chances and possibly get COVID and possibly end up in the hospital and or possibly die.
Okay.
That it's a no-brainer for me. I'm not
Absolutely.
trying to lessen anyone's fears because the fears are real, but I'm just here to try and help you guys know that it's okay, that it's safe. I wouldn't recommend this. My husband, he doesn't get the flu shot at all. And when I tell you, when his friend passed away, it was like a veil had been lifted, and he's like,
Wow.
"Okay, when can I get it? When can I get it? When can I get it?" And I just think that we have to be mindful. It's not just for us; we're helping other people. And
Absolutely.
okay, just say everyone in America gets vaccinated, right? If other countries aren't vaccinated, we're not going to get past this pandemic. So it's like each one teach one, each one save a life. Do your part to help save a life. And that's where I am. The advisory panel for the CDC will meet on tomorrow to see what they're going to do with the J&J vaccine. Now, in my educated guess, I'm thinking they'll probably let it come back out full throttle, or they'll say with the warning, or they'll say it's for 50 and up. And anyone under 50 would have to get the Moderna and or the Pfizer.
Okay.
So it's too important. I know personally too many people have passed away, and I see it every day. I don't personally see it, but I see the people come in and they tell me about their experience with COVID and how they're still having symptoms from it, all these months later. And I just try to listen to them and just say it's going to be okay. But you too, even though you've had it, you still should get vaccinated. So that's pretty much it. What's going on with the 3 vaccines that we currently have.
Thank you so much. What a great discussion, Tanya.
Thank
She explained everything in detail, the different types of vaccines, how each vaccine is administered, the side effects, and who should and should not get them, as well as giving us an update on the J&J vaccine. Again, thank you so much. So why should we receive the vaccine, and what should you expect when vaccinated? These are just a couple of the questions that Dr. Kara St. James and Dr. Courtney St. James will answer as they go about debunking myths by giving us scientifically proven information dealing with facts versus fiction. As you know, there is a whole myriad of false and misleading information floating about. Most of this information makes no sense. You wonder where it comes from, and you wonder why it would be repeated, but it's happening in our own backyard, and it's happening right in our homes. So we are certain that this tag team will be able to answer the questions and keep us on track of vaccination and our well-being of others, specifically the elderly and the infirm. Dr. Kara and Dr. Courtney St. James.
Good afternoon. Thank you, all of you, for inviting us to come here. So let's just start thinking about why we should get the vaccine. And I'm going to tell you personally why I got the vaccine. I got the vaccine because I want to hold this little one here, and I want to play with her, and I want to be with her. I got the vaccine because I want to go to the family reunion this summer and not worry about making my elderly 80-year-old aunt sick. I got the vaccine because when someone asks me, can I borrow your pen? I don't feel kind of funny about letting them borrow my pen.
Right.
I got the vaccine because I want to go out and have dessert, not eat the whole one and taste her dessert and let her taste my dessert and not worry about, well, does she have a patient who came to see her and who was sick. So I got the vaccine because I want to go to church and I want to fist bump and I want to touch my neighbor when my pastor say touch the neighbor. I got the vaccine because I want to hug again. And I'm not that hugging kind of person, but I'm going to hug a long time next time. I think we took for granted hugging. If we do not get that vaccine, we're going to kill each other. It is our people in my practice who died, 8 of them. And these are people who have been in my practice for a very long time. One person had no underlying conditions. He was 48 years old and he died. And then I have people who, of course, have underlying conditions. I don't want to make them sick. I don't want them to make each other sick or our community sick or their family sick. We want to travel again. We don't know what it's like anymore. I don't know what it is, but we want to figure it out again. What is normal? So this is why we should get the vaccine. It is deadly, and that long hauler effect is real. Even if you don't die with it, you feel awful and tired most of the time, and that's a horrible feeling. We all got passions, we got services we want to do for our community. We want to continue to be who we were, and without getting that vaccine, that's not going to happen. So this is Courtney, why did you get the vaccine?
Oh man, I have so many reasons why I got the vaccine. This little girl, my 2 boys are definitely one of the main reasons I got the vaccine. I want to be able to see my family members again. I feel like even my own loved ones either passed away from the COVID-19 or even that they battled it themselves. I mean, it's so important to educate, our community, our own population, our own Black and brown skinned people, why we should get it. And this is just so many things that have happened in the past about why you shouldn't get a vaccine. I certainly in medicine. I mean, I didn't make this far without it. We've all done very well from numerous vaccines that we've received in the past. So certainly we want to get back to some sense of normalcy, whether it's, had herd immunity from people being infected by the vaccine versus us getting herd immunity from people being infected by COVID-19 versus getting the vaccine. But there are a number of reasons why we want to get back to a sense of normalcy these days.
Okay, that is you guys came through with many good reasons why we should be vaccinated. I myself was vaccinated for some of the same exact reasons you guys were vaccinated. And it's important for our audience to realize that the only way that we can get back to some form of normalcy is to be vaccinated. I hope that you guys will hang around. We're going to have a question and answer period. I am reminding the audience to please put their questions in the chat box so that you guys as experts can answer those questions. In the meantime, we're going to move to our next guest. We have Miss Denise Air, Department of Health. She's going to talk to us about the efforts being taken to vaccinate our communities.
Good evening. I want to say thank you very much for inviting me. I wanted to say that it's a very important thing that we're doing to vaccinate every part of every community and bringing the vaccine where the people live. We've done some vaccines in some communities, but we are moving forward. We are working also with Embry-Riddle and doing some church events as well in underserved communities. When we leave the fairgrounds, in addition to some of the smaller sites that we've been doing with the county, we will be doing more community pop-up sites. We've also begun vaccinating at our health departments. We started first in New Smyrna, and we're rolling out to Orange City, in Daytona, Holstenbeck, and also Keach Street. We will have one evening hour appointments in Holstenbeck, and we will be offering some Saturdays as well for the vaccination. So all of that, of course, because of the viability of the vaccine, once we open the vial, we must use it within 6 hours. Otherwise, we have to waste it. So we encourage everybody to walk in. I know sometimes people have had an issue with getting appointments, and we have accepted walk-ins numerous times, both out at the fairgrounds and the community events that we do as well. It's very important that there's a vaccine for everybody's arm. If they show up, they're going to get vaccinated. And I think it's important that we let our community know all you have to do is show up. We'll vaccinate you, even if there's not an appointment. There's plenty of vaccine. Just come in and we will definitely help you out, and we'll put that vaccine in your arm.
Well, that is certainly good to know. I mean, of course, in the very beginning, there were lots of obstacles to people, being able to get vaccinated. So to hear that you can actually just walk in, that is critical information for our audience to know and to pass along. Can you tell me what is being done for the homebound and the homeless?
Absolutely. So there's actually two-tiered. So the state IMT teams have gone out and done mass vaccination throughout the state. And in addition, the Volusia County Health Department goes out and vaccinates the homebound. Now, we've gone everywhere within the county to vaccinate. We usually go with an EMT, but sometimes we also use 2 nurses to go. We want to make sure that we practice safely, and we ensure that we have an EpiPen and all the equipment that is needed in case somebody does have a side effect or any effects from the vaccine. So if anybody is homebound, or maybe they're not necessarily homebound, but they really have mobility issues and they don't feel that they could get in and out of the car at the fairgrounds. So we have gone outside at the fairgrounds and vaccinated people. We have had them come to the health department. We vaccinated them there as well. People who couldn't get there by 4 o'clock at the fairgrounds, we've made arrangements and vaccinated them at the health department after we finished at the fairgrounds. We've tried to be very accommodating to meet everybody's needs, to ensure that we do get everybody vaccinated, because it is important. Everybody needs to be protected that wants to be protected, so that we can protect everybody around us and keep everybody healthy.
Thank you so much for that information. Great, and thank you for coming on as one of our panelists. At this time, we will now move into the question and answer session. And again, I'm reminding you to put your questions in the chat, and whatever questions that are posed, I'm asking my panelists to please feel free to jump in and answer the questions, as well as the question that was just posed to Ms. Ayers. If there's anyone on the panelist group that can offer other information on what you're doing for vaccination opportunities, we can start with that question. Thank you. All right, Councilwoman.
Thank you. I just wanted to mention that we are looking for new sites. So we have seen the demand kind of diminish. So I think we're looking within the community to say, where are some of those pockets that we can reach into and make that connection. I also wanted to say that Equal Ground has been a great resource. When we do have an event, they are able to do a text and a reach out by zip code and by area and get that information further out into the community. And I think that's even more important as we look at trying to vaccinate younger ages, that we have that reach. So I thank Equal Ground for making those resources available, because they have helped us be more effective.
Thank you so much. A great answer. I have received a question from the audience. What can we do to convince Black individuals between ages 20 and 40 to be vaccinated? Who would like to take that question?
I'll start. Oh,
All right, thank you,
okay.
Tanya.
Yeah, I just think we have to go where they are. I think we have to perhaps show them some young men their age, those that look like them, who have already been vaccinated, to speak up. Also, it's going to take more than just me. It's going to take more than this panel to convince people to get the vaccine. What it is going to take for people who have already gotten it, who look like them, who are the same age as them, who live in the same community as them, to convince them to get the vaccine. And I believe that's what it's going to take. So if we can have some young men who can step up, help us, the women can't be out here alone doing it. The men have to step up too and lead, take the mantle and lead in this as well. It could be done. People follow people all the time. And if it's someone that they look up to, they'll be more than willing to take the dive or the leap.
You're absolutely right. Thank you so much.
I think it is about trusted voices. It's about trusted voices within your own sphere of influence. My mother and two sisters said they weren't going to take the vaccine, and I'm glad I was able to convince them to. But everybody starts out with that concern. But I say, which would you rather contend with, the virus, right? And let's really lay out, what you've seen from others that have been impacted by it in the hospital for weeks. Maybe they come out, maybe they don't, or you got a headache and a sore arm, for 48 hours. In most cases, I'll work with that. So, and I'm glad they did, and I'm glad they trusted my voice, and I hope others will too, because I know it's critical.
Thank you so much. Dr. St. James?
Yeah, I certainly do agree with that. I do believe that you have to go to where they are. You have to meet this generation where they are, because sometimes they may not be as open to say, okay, yeah, I'm going to do that. But if you can find an opportunity to take the vaccine to the colleges or age rooms of 20 to 24, then they're going to tell someone that told someone else, and tell someone else that, hey, this vaccine is available. I took the vaccine, I did great with it, and I think that they will be more inclined to take the vaccine, of course. I'm fully vaccinated. I'm a young person as well, so I do like to educate my young people on the importance of getting, especially people of Black or brown color. So go to where they are. That's going to be certainly big, and just spread the word about it. I think they'll be more receptive to it.
Absolutely.
Yeah, I'm sorry. I was going to say, even if we have to set up a vaccination station on Mary McLeod Bethune, then that's just what we have to do, because that's where they are. Again, that's going where they are.
I made several deliveries of PPE to the Bethune Grill. So
okay.
Great.
That's where they are. That's where they are. So I handed them out right there. So take them to where they are.
Maybe we could do there. And I'm a certified immunizer too. So I'm more than willing to help. So
great.
You think about the people that come to the beaches, the young people that come to the beaches. We have to think about the holiday that's coming up in May as well. That's when we saw the fight last time, last year, around this time last year. People wanted to get out and do things and come to the beach, and that's when we saw the fight go up. So even doing it, around that time. I don't encourage people to, go out to the beach in that sense, but we know realistically people are going to go. That's an opportunity there to immunize that young community as well.
All right, great. Thank you so much for those answers. I have another question. For those wondering, there have been, I'm sorry, let me get back to my question. For those wondering, there have been 132,325 people totally vaccinated in Volusia County. Yay!
Right. Yes.
We have 150,000 more waiting on their second shot. That's even better. So
Great.
again, getting the word out. And it's both for our young folks and some of the older folks. I'm going to throw out a faith-based question. It is very common to hear within our faith-based community that we are protected, that we are, quote, covered with the blood of Jesus. And basically, no harm will come to us because of this. So how do you address the mindset of these folks? Anyone?
I was going to say real quick, God has given us wisdom too. That's all I got.
Well, and I would say, don't we vaccinate our babies? Don't we trust the vaccine, at the early stages of our child? And again, we want to be here to, maintain and be with the family and love on people. And it's a similar process. So.
Exactly right.
I described to them how Jesus was actually the first pharmacist, because there was a blind man one time, and he didn't just say, okay, you can see and touch his eyes. He picked up this dust and he spit in it.
He did.
And he a bomb, and he put the bomb on the eyes of the man, and the man could see partially. He said, I see better, but they look like shadows. And then Jesus had to adjust the medication. He had to manipulate the drug, and he puts up some more dirt, and he spit into that, and he put it back on the man's eyes, this bomb, and the man said, now I can see. Well, that was pharmacology. He was actually one of the first ones to use other methods. So I suggest that we cannot put the Lord into a box and say, you got to heal me this way. We got to open that up and let the Lord heal in all the different ways he's given our minds to allow for healing. Healing comes in so many ways, and this is just one of the ways. So
exactly.
One of the ways I do approach that.
All right. Thank you. That's wonderful. I do have another question from the audience. They are specifically looking for the Pfizer vaccine here in Volusia County. Can someone give us some direction on that?
The Volusia County Health Department does not provide the Pfizer vaccine. Advent Health was providing the Pfizer vaccine, and Publix, CVS, Walgreens were carrying the Pfizer vaccine. And Lake County also has it, but again, that's Lake County. Orange County has the Pfizer vaccine, but pretty much it's just the pharmacies here in the county and Advent Health and Halifax when they have it.
Okay.
And I'll add to that, I think more and more opportunities for appointments have been opening too. So it's probably you may have success in getting it.
Well, another question to go along with that, if you start with one vaccine, can you take a second vaccine or different vaccines? Well, let me just say this. You start with Pfizer as your first vaccine. Are you able to take Moderna as the second? Does it have to be the same vaccine?
Now, second shot. Now, what I think is going to be interesting, because Pfizer's already said that they're probably going to give out a third shot, and Dr. Fauci's had some issue with that. So I'm thinking, because that's what was studied in the clinical trials, this vaccine, Pfizer, one shot, two shot, Moderna, one shot, two shot, J&J, one shot. So that makes sense to do one shot, two shot with the same vaccine. Now,
Right.
beyond this, or 6 months from now, we don't know. So you may be able to switch, but we just don't know yet.
Okay. At this time.
It's not the recommendation currently. I agree with that. They're
Okay.
actually saying quite the contrary right now. Do not mix the vaccines. That's one of the questions that they always ask. Have you received any other COVID vaccine? And if so, which one?
All right, wonderful. That's good. Right at this time, since we are getting out and being vaccinated, a lot of people think that once they receive their vaccination, the mask can come off. And of course, we know that is not the case. Can someone speak on?
I'll be more than happy to. I can tell you that working the vaccination clinics, I've worked pretty much every one of them until this past week, that 14 days after you're vaccinated is when you will have partial protection after the first dose. 14 days after dose 2, you would have up to 95% with the Moderna. With that being said, that's not 100%, number one. Number two, you can still catch the virus, carry the virus, and give it to others and not even know that you're sick. And you can even develop one of the variants. So that's why it's important that we continue to wear the mask to protect everybody around us, to do the right thing and stop the spread and the development of further variants from developing.
Great. Now, I know that I have read some CDC information that states if your family and if everyone in your family is vaccinated, then can go without your mask at home around your family members or people that you know have been vaccinated, but certainly not in public around people that you don't know. And that's the consensus, correct?
Correct.
Okay. Let's see. I have one question. I'm considering being vaccinated, but do not have a primary doctor to consult. What should I do? Do you need to have a primary doctor?
The primary care physician is not required in order for you to be vaccinated. The vaccines are, given out in many different locations, so certainly it's not required. However, if you do have some concerns or some underlying health conditions where you do feel that you should consult with your primary care physician, then certainly I do encourage that. They're not required. We're not required to be consulted in order to receive the vaccine.
Okay. All right. But are you saying if you have other conditions that you probably should try to see?
If you have some,
I mean, I would want to, but if that's going to prevent them from being vaccinated and we really need shots in arms, then unless there's known allergy to the vaccine itself, then you probably would encourage them to go ahead and be vaccinated.
Certainly. That is for sure.
Yeah.
Oh, I'm sorry. One more thing left out is you brought up allergies. In the Moderna and the Pfizer, they use what is called polyethylene glycol or PEG. You find that in Miralax, and that's what they use the fatty substance to make the RNA go in, messenger RNA get into your arm. So if you're allergic to that, I'll throw that out. So if you're allergic to Miralax, if you ever taken the over-counter stool softener, then
okay.
yes. So yeah, if you're allergic to that, then you would not be a candidate for that. And I'm talking like an anaphylactic shock, like a type of allergy. So
Wow.
I forgot.
Now,
Yeah.
is that an information that you would receive prior to getting that shot?
It is listed in the emergency use, well, at least what the health department hands out, it does list all of the components. And if anybody says that they do have allergies, we ask specifically, what are your allergies, so that we can inform them correctly before they take the vaccine.
Wonderful.
And let me just say one thing. I've had people to ask me, how much does it cost? There are some communities that actually think that there's a cost to the shots, especially in some of the Hispanic communities. I've been asked, how much does this shot cost? So they are not understanding that this is covered by the federal government, and that there's not a cost to this shot. So you don't have to have a primary care doctor or money to get this shot.
No, and we've actually had individuals that, because they were not citizens, thought that they could not get the vaccine, but we definitely told them that that was not a reason not to be vaccinated. So, there is no charge, and citizenship is not a requirement.
That's right.
Awesome. Great. That is good to know. Well, ladies, it's great. I am going to give one final question, and then we will bring this to a close. I hate to do this, but we have been going for a little over an hour right now, which I guess is a good sign. The question, has there been a spike in mental health treatments because of the impact COVID had on people? Who would like to take that question?
I call it the pandemic panic or pandemic anxiety. I've found that, patients who don't usually have any issues with any mental health problems have had a hard time adjusting to, the new norm that we're trying to live through right now. And it has caused a lot of mental health concerns. And I always say, reach out to a loved one if you have any, concerns about your own well-being or the well-being of someone else, because it's real. It's truly real. So I would definitely encourage, just have a conversation, because there's someone out there that can either help you or direct you in the right direction to get some help.
And the loneliness is real. We all have to realize that this thing has caused so much loneliness. I've never had an Easter table that was with so few people around it. We need to be together and just say, are you lonely? I'm lonely. It's okay to say I'm lonely and that I want to be around people and I want to be with people. We need to let that be okay to have this mental health issue. Because it's just causing a lot of isolation. There are a lot of older people who live alone that are afraid to come out. I had people that had not been out in a year, and then I've had people that my office is the only place they will go. So we have to think about that and just offer up time and friendship and space for these people, whether it's on FaceTime or it's a phone call or whatever way we can, because the loneliness has caused a lot of dementia. Believe it or not, people have lost their memories as a result of not talking to someone.
Wow, absolutely, yes.
We need to actually have interaction, human interaction. And this has caused a lack of that interaction. And we have seen a whole lot more depression.
Wow. Okay. Thank you, ladies, so much.
I have one other thing I'd like to mention, and that is that wasn't it. There's 2 upcoming events. One is Friday, April 30th in Pearson, and they usually start in the afternoon. And Wednesday, May 5th, will be in New Smyrna Beach, and that's a Wednesday. So there's 2 upcoming events, one in Pearson and one in New Smyrna Beach.
Okay, thank you so much. And you are speaking of vaccination events?
Yes, 2 vaccine events. Yes.
All right. Thank you so much for that information. Okay, so we're going to wear our masks. We're going to still wear our masks even though we vaccinated. We're going to social distance, and we're going to continue to wash our hands. It's been such an enlightening town hall. We have received a plethora of information, all designed to afford us the ability to make informed decisions. Personally, this has been so helpful to me, and I'm sure many of our guests, our audience that's listening in. We are learning, we learn so much. There's so much going on. Every day we hear new information from experts. And we need to hear that information from our community on a regular basis. So we need to come together more often because it really is beneficial to all of us out here. You know, things are just changing drastically, scientifically. But to our panelists, Councilwoman Barbara Gertman, Dr. Tanya Williams, Dr. Carol St. James, and Dr. Courtney St. James, as well as Ms. Denise Ayers, we cannot thank you enough for your expert advice. I think that you've helped so many people understand key information about the vaccine, about its safety, about its efficacy, so that hopefully they will make an informed decision to take the vaccine if they have not done so yet. So at this time, I will respectfully return the virtual mic back over to Mrs. Genesis Robinson.
All right, thank you so much. Thank you so much, Mrs. Mann. That was a very informative conversation, and I think that our community is the better for it. Certainly a wealth of information that was shared, and we are grateful for all of our panelists for participating and offering their expertise. At this moment, before we wrap up, I'd like to show a video that was produced by Volusia County, thankful, courtesy and because of the hard work of Councilwoman Barb Gertman, a PSA with trusted voices in our community, encouraging folks to be vaccinated. You can watch this video on the county's website, but we're going to show just a snippet of this video. So if you can just hold 1 second, we're going to show that now.
Get the shot. Por favor, vacúnate.
Get the shot.
Get the shot.
Get the shot.
Get the shot. Get the shot.
Póngase la vacuna. Get the shot. Get the shot. Póngase la vacuna. Get the shot. Because your life or the life of someone you love could depend on it.
All right, great. So we hope that this forum provided you with some very useful information that you can use as you make up your mind or to encourage others to get the shot, and so that our community can come out on the other side of this safer and the better. So thank you all so much. Please, if you'd like to stay connected, follow Equal Ground on all social media platforms. We're on Facebook, we're on Twitter, we're on Instagram. And then you can also visit us on the web at www.equal-ground.org. vaccine-ground.com. We're doing great work throughout the state, and we can always utilize volunteers and folks. So please stay connected with us and help us continue to serve our community. Thank you all, and all have a good night.